So let's continue our topic on anti-rheumatoid drugs. Today we will be talking about the acute gout. So what happens in acute gout? Acute gout is basically a very severe and sudden inflammation that occurs in the small joints of the body. There is very severe inflammation in the small joints of the body in acute gout, and the most commonly involved joint is the first metatarsophalangeal joint. What happens in acute gout? There is deposition of uric acid crystal in the joint spaces, and the most commonly affected joint is the first metatarsophalangeal joint. And because of the deposition of this uric acid crystal, there occurs the formation of tophi in the joint spaces of patients of acute gout. And this uric acid crystal which gets deposited, it causes very severe pain in the joint, and the joint becomes very red, swollen and painful. And because of very pain and swelling in the joint, this condition requires very immediate treatment, and that's why we have various drugs to treat the acute gout. First we will be talking about the non-steroidal anti-inflammatory drugs. As the name says, they have very strong anti-inflammatory action, so they are the non-steroidal anti-inflammatory drugs. And the drugs which include in non-steroidal anti-inflammatory, these include your naproxen, piroxicam, diclofenac, indomethacin, etoricoxib. So these are various non-steroidal anti-inflammatory drugs. As we know, they have very strong anti-inflammatory action, so they suppress the inflammation. However, you should be knowing they don't have any action on the uric acid production. They do not alter the level of uric acid, they only suppress the inflammation, and their action usually take 12 to 24 hours to take the effect. With regard to colchicine, colchicine acts quickly. Is colchicine another drug used in the gout? Colchicine acts quickly, but these non-steroidal anti-inflammatory drugs take 12 to 24 hours to start their action. As we know, they have no action on the uric acid level. You do not alter the uric acid level, and as we know, their action is slower than colchicine. As we know, these drugs has to be given for 3 to 4 weeks after the acute attack is over. When the acute attack of gout is over, we will continue to give these drugs for 3 to 4 weeks, because for 3 to 4 weeks, the other drugs which are actually controlling the uric acid level, their effect takes time. Until their effects take into account, their effects take place, we have to continue these drugs to suppress the inflammation. Once the other drugs which suppress the uric acid level, they take their effect, we have to remove these drugs. As we know, their long-term use is not recommended, because long-term use of these drugs can cause toxicity. Now another drug is colchicine. So colchicine is another drug which is used in acute gout. It is basically an alkaloid, and this alkaloid we derived it from colchicum autumnale. Colchicum autumnale, which was used in acute gout in 1763. It was used in since 1763, and it is an alkaloid which is derived from the colchicum autumnale. So this colchicine is neither an analgesic or not. It is an anti-inflammatory. It has no anti-inflammatory nor analgesic, but it does suppress the gouty inflammation. We will see how does it suppress the gouty inflammation. So we first understand how the mechanism of action in gout. What happens in gout? There is, as we know, there is a lot of uric acid being produced in the body, and this uric acid goes to the joint space. This is the joint space I have drawn. This is the joint space, and this uric acid in the joint space, we have these synovial cells. What they do, they engulf these uric acid crystals. Once these synovial cells engulf these uric acid crystals, they start producing lot of chemotactic factors. They produce lot of chemotactic factors, and these chemotactic factors start inviting your neutrophils, your leukocytes, and these neutrophils or the leukocytes goes in the joint space. And once these leukocytes goes in the joint space, what they do, these are the leukocytes, they start engulfing these uric acid crystals. These uric acid crystals being engulfed, as we show here, this being engulfed by these neutrophils. And once they engulf the uric acid, then they start producing glycoproteins. They produce lot of glycoproteins, and these glycoproteins then goes to your inflammatory cells. These are the inflammatory cells. We have monocyte, macrophage, fibroblast, all the inflammatory cells. These glycoproteins stimulate these inflammatory cells. They cause the production of lactic acid from these inflammatory cells. They also increase the production of lysosomal enzymes from these inflammatory cells. These are glycoproteins. And then this lactic acid and lysosomes, these lactic acid and lysosomes start going into the, they are in the joint space. They will destroy this joint. They will destroy the joint. They are going into the joint space, and as we know, they will act on this joint space. This lactic acid, as we know, the lactic acid will lower the pH in the joint space, and this low pH will precipitate these uric acid crystals in the joint space, producing the lesion of tophi in the joint. Also, these lysosomal enzymes which are being released, they ultimately destroy the joint of patients of this gout. So here this was the how does the gout acts. Inflammation starts in the gouts. So what these colchicine do, they basically inhibit the release of these chemotactic factors from the synovial cells. Here does your colchicine acts. Also, they inhibit the migration of leukocyte into the joint space. They inhibit the migration of leukocyte into the joint space. Also, they inhibit the production of glycoprotein from these leukocytes. These glycoproteins are not being produced because of the action of colchicine. Then other uses of colchicine include because they act on the mitotic spindle and arrest the metaphase arrest. They cause the metaphase arrest. That's why they were used in cancer chemotherapy, but due to its toxicity, it is not used nowadays. So it causes the metaphase arrest. These are the other actions of colchicine. Also, it increases the gut motility, and therefore it can cause diarrhea as a side effect. So this was about the actions of colchicine.